Hey everyone, it's Dr. Ross again, coming at you from my home office. Again, I think this is more comfortable for me. I get so busy during the week, I don't have a lot of time in the office now anymore to make these videos in more of a formal setting, so I do it in my own home. So I'm always working weekends. I'm always gonna work on the weekends too. So anyway, appreciate your time. Again, thank you everyone for sending in your questions to my social media. I promise you I'm gonna get to every one of my questions that my patients ask me to. So I just have a long list. I'm just churning through them. So anyway, this is a great one. It's about abdominoplasty or tummy tuck, and the question is 5 facts about getting a tummy tuck. All right, great topic. So first fact. It is not weight loss surgery. It is not. I can't explain that to you enough. Like, it does not weigh a whole lot. You know, a tummy tuck, what it's gonna do is gonna remove skin and fat, usually typically from the belly button down. A very common question is, how much did it weigh? I know exactly when I weigh it, but typically it's not gonna be like 5-6 pounds. It's not gonna happen. It's just not the way it works. It's not weight loss surgery. It's a contouring, rejuvenation of abdominal tone kind of procedure. Liposuction is always added. I always add it for me personally, just to kind of help further enhance and sculpt the waistline and the abdominal contour. So it is not a weight loss surgery. Please, that's a common misconception. Second fact, there are different types of tummy tucks. It can, at the low end, there's called a mini tummy tuck. The next one is more like a regular tummy tuck. The mini tummy tuck, what that is, just removing just the skin, just a little bit of skin. If you have a C-section scar, you know exactly what I'm talking about. You have like a little bit of skin on the lower abdomen. Basically, if you pinch that with your fingers, that's what a mini tummy tuck is. It's about just a little bit longer than the C-section. Doesn't do a whole lot. A mini tummy tuck gives you many results. Not very many women need a mini tummy tuck. I know you want one. I'm sorry, most women don't meet that indication. Okay, it doesn't. It does not fix the muscle separation of pregnancies. Does not do that. Mini tummy tuck does not move your belly button. It does not do that either. So the next level is a regular tummy tuck, which is I fix your muscles, I tighten your muscles back up. The belly button's moved into a new location because I pulled that skin down and then I gave you a lower incision line to get all that skin off. The skin that's removed is from the belly button down to the level where a C-section is. That incision line is typically going to extend to probably like where your hip bones are, most likely. That's a regular tummy tuck. The next level up is more an extended tummy tuck. I call it extended tummy tuck. Extended tummy tuck is when the incision line goes just past your hips. And if you're laying flat on the table, it's basically where it hits the table. I can't go any further than that. That's, for me, the extended tummy tuck. That's work that I can do when you're lying flat. It also fixes your muscles. I fix your muscles back up. I remove all the skin from your belly button down to the level of C-section scar, and the belly button put in a new spot. Okay, and that's an extended tummy tuck. The next one up is the next level. It's called like a body lift. So body lift typically takes off skin. In addition to the tummy tuck skin, it takes off skin of your hips and your upper butt, kind of lower back area. It's kind of, they call it 360. I don't really typically do a 360 very often unless you've lost a lot of weight. But it just helps kind of further enhance the contour of the waistline, get everything nice and tight. And the purpose of that is that if you have loose skin on your hips and your incision does not go long enough, you're still gonna have that loose skin on your hips and you get these big bulges, and they call them dog ears. They're awful, patients hate them. The way to avoid dog ears is you make your incision longer, okay? You have to make it longer. So every patient's gonna fall in the spectrum. Probably the ultimate version, or the most labor-intensive version, is called a fleur-de-lis tummy tuck. And what that does is, for someone who's lost a lot of weight, we're talking about 50, 100 pounds, whatever, they have a lot of stretched skin. They have extra skin from this way, from top to bottom, but also side to side. And so that's what's incorporated, is that the tummy tuck takes skin from here to here. The fleur-de-lis takes skin from here to here. So it pulls the skin in like this. That requires an incision that goes right down the middle. Okay, and that's called fleur-de-lis. So you have a T, it's kind of a long one right down the middle, and then it continues with the tummy tuck scar on the sides. So it's a spectrum. Everyone's going to kind of fall in that somewhere along that line. In my hands, I'm not going to give you a long scar if you don't need it. I do what's necessary. If you only need a mini tummy tuck, all the power to you. I'm going to do it for you. Okay, I'm all about it. If you need a full one, you need a full one. If you need extended, sorry, you got to do that. It's just, or else you're gonna have these dog ears. You're gonna hate them. Okay. All right. Third fact. Regardless of the scar or whatever, regardless of the type of tummy tuck you're gonna get, you will have a scar. I'm not a magician. Okay. Every time there's trauma to the skin, you will have a scar. Anytime there's trauma to anywhere in the human body, your body forms a scar. You know, as surgeons, at plastic surgeons specifically, our goal is to give you the best looking scar possible in well-conceived places of the body. So, you know, it depends on, you know, how much skin you need to remove, you know, many to the fleur-de-lis. But the idea is we close your incisions with multiple suture layers to give you thinner scars because they're supported longer. I personally use a lot of silicone products. I use, you know, products after surgery to help further support the incision line and decrease risk of the problems. Okay, fourth fact is that you can still get pregnant after a tummy tuck. Yep. So if you get a tummy tuck and you spend all this money having a tummy tuck and, you know, you're enjoying life and then, you know, you have an oops, or I don't know what happened, you can still get pregnant. Your baby will have plenty of room. Your body stretches. It just doesn't stretch along the middle, but the rest of your tissue stretches, okay? You know, the suture repair is not gonna stretch. It's just your tissue stretches. So will you need a revision tummy tuck in the future? Very likely. I do that actually more than you think. It's not, I don't take as much skin off at that time, but typically you have to do some more liposuction and contouring. Sometimes you have to tighten up the muscles back up again because, you know, the rest of the tissue around the plication repair has been stretched out again, so you gotta tighten back up again. So you can still get pregnant, okay? No problems with having a baby from that. All right, the fifth fact is tummy tucks are not just for women. I do them for guys. And it's typically for guys, it's gonna be a guy who's lost a lot of weight. It's called massive weight loss surgery. And they have all this damaged, stretched out skin with tons of stretch marks. They've lost, they're wearing a big skin suit. It's just the way, that's what it is, a big skin suit. And then my job is to retailer their body. So typically the body's gonna be, you know, the abdomen, doing a chest lift, same thing. I had to take all the extra skin on the chest off. You know, it's actually very common for massive weight loss. I don't know any guy who's lost a lot of weight that didn't need a tummy tuck. But anyway, it's just not for women. So anyway, that's your 5 facts related to tummy tucks. Hope you learned something. Thank you again for watching. Keep sending your questions. Appreciate you. See you next week.